What are secondary findings?
Secondary findings are a type of genetic test result that somebody might get when they're getting genetic sequencing for some other reason. When that sequencing is done, the genetic testing lab may also look at this list of 70-something genes that are on a pre-approved list from the American College of Medical Genetics and Genomics that we know these genes have a really strong association with certain preventable health conditions. Most of them are related to things like cancer or heart disease, but there are a few other conditions on that list as well. And if you are found to have a genetic variant, the lab will let you know so that you can get preventative treatment or increased screening to try to catch one of those conditions early.
What is GSRP?
The Genomic Services Research Program is a research study that asks people who have received some of these secondary findings or unexpected genetic test reports to share their experiences with us. And in this, we're trying to accomplish two different aims. The first is to ask, out of the people who have received one of these secondary findings, who actually ends up getting diagnosed with the condition that is associated with that gene. The second aim of the Genomic Services Research Program is to learn from people who have received these secondary findings what that experience was like for them, how it's changed their healthcare behaviors, what it was like if they've shared that information with their family or why they haven't shared that information with their family, and how it has affected their feelings or beliefs surrounding their risk to develop these conditions.
What are you asking of participants?
In the Genomic Services Research Program, we ask people to share their secondary finding or unexpected genetic test result with us. We also ask them to fill out a survey that explores how they have reacted to receiving one of these genetic test results, whether it's changed how they think about their health or their healthcare behaviors. We'll also ask them whether they've shared the information with their family members and whether they ended up getting diagnosed with the genetic condition that the secondary finding indicated they had an increased risk for. We also ask them to be interviewed by a genetic counselor, and in this interview we really explore some of the how and the why behind their reaction to these results. Another component of this study is if people haven't yet gotten checked out for the genetic condition that their result indicated they had a risk for, we may invite them to come to the NIH Clinical Center for clinical examinations or testing to see if they actually have the condition that they could be at risk for.
How can a doctor's patient join a study?
If a doctor's patient comes to them and they've received one of these secondary findings or unexpected genetic test reports from a direct-to-consumer test or from a research study that they've been involved in, we really want the doctor to take that result seriously, because there was a lot of thought and intention that went into deciding what genetic test results would get released to the patient. And these secondary findings indicate that their patients have a really serious risk to develop one of these genetic conditions. There are increased screenings or treatments that patient could be eligible for that could really save their lives. The patient might not seem like they're sick, and they might not know of a family history of that condition, but that doesn't mean that they're not at risk to develop it down the line.
How can GSRP be contacted about a patient?
If your patient has received a secondary finding, we want you to text or call 240-408-0447. We have somebody on the line waiting to receive information about your patient and their genetic test result so that we can enroll them in our study. You can also visit genome.gov/GSRP and refer your patient to our research study that way, or email gsrp@nih.gov. We would be happy to talk to your patients to hear about their experiences receiving one of these secondary findings so that we can use this information to better inform how we can treat these patients in the future.